October is Breast Cancer Awareness Month. We are looking at the financial implications of breast cancer with Molly MacDonald. She's founder and CEO of the Pink Fund. Nice to have you here.
Thank you. It's great to be in New York.
We should explain about the Pink Fund briefly. You basically help people with financial assistance who are in need and going through breast cancer treatment.
Correct. We are the only national nonprofit that focuses on non-medical financial assistance for 90 days to help breast cancer patients in active treatment.
And there are a lot of financial concerns, which is not, of course, the first thing somebody is going to think about with a breast cancer diagnosis. Once you get through the shock of a diagnosis, what's the first most important question a patient should ask when it comes to financial care?
Well, a patient needs to sit down with the doctor, if they're a working individual, and say, I'm concerned about the cost of treatment. Who can I talk to at the hospital about my concerns? Do you have a financial navigator on staff?
And oftentimes, do they find that navigator?
Well, all hospitals are now required to have a patient navigator on staff. Often they'll add that financial navigation piece to it as well, because as you know, hospitals do not want to be left with uncollected debt.
And how should somebody prepare beyond speaking with an advisor? How should they think about budgeting for the next few months of what will be a very difficult time in some case?
Well, most Americans are not really aware of what their month-to-month household expenses are other than the basics. So the first thing to do is really take an inventory of what your bills are. Secondly, what can you cut out? In my case, we sold a car. If you get a weekly manicure, stop that. Maybe you can stretch your haircuts. There are things that you can start to do to pull back some of that cash outflow.
And there are other things that perhaps you might not even think about. You might need different clothing. You might need other things as the treatment goes on that you would not initially think could be costly to you on top of whatever medical bills you have.
Well, for many patients, they have children in child care, and if they're not working, they can't afford to pay for the child care. So that's one thing you have to think about. Who's going to take care of the children if I'm too ill and can't have that child in daycare? Another one might be cleaning your home. There's a wonderful organization called Cleaning for a Reason, but not everybody can use it. Women in treatment or men cannot be around toxic household cleaners. So there are all these other things that you need to take into consideration around how the disease is going to affect you. Maybe you're going to need lots of things that your insurance doesn't cover. Some insurance does not cover wigs. If you have lymphedema, sometimes that doesn't cover that garment for compression.
You also say that you should be your own advocate. How?
Well, if you can't be, and if that's not your temperament and personality, I say find your most mean, nasty, take no prisoners friend and take that person to treatment with you and demand that that person get the answers you need and don't leave the room until you get them. To be your own advocate, you have to educate yourself. There's a lot of information and there's a lot of misinformation on the internet, but the first step is to say, like if you were going to remodel your home or put on a new roof, you would bring in 3 people to give you 3 bids. It's the same thing with your health care. You have the right to know and don't assume the doctor is always right.
You also believe you should work with your employer. Do we find that most companies will work with their employees? Not everyone is a full-time worker with benefits.
I think it's really challenging for smaller employers to really handle a patient who's going to have to be out for an extended period of time. Fortunately, in this country, the Affordable Care Act allows for patients of 50 or more employees within a 75-mile radius of one location to take up to a 90-day unpaid medical leave annually. If that's not possible for you, then you can go to HR and you can disclose what's going on, but you do risk possibly being told that you could be laid off, that they're having a general layoff. So we really don't recommend that you openly disclose your illness. That's entirely up to you. There's another site called Cancer and Careers that has a lot of great information on that.
Final piece of advice on the financial side for patients.
There are resources. For breast cancer, the Pink Fund is one of them. It's a 90-day program, up to $3,000 to pay some of those non-medical bills directly to the patient's creditors. On our website, there are other resources for other types of bills, medical copays, wigs, prosthetics, all of those things by state. And we have a patient navigator on staff who's willing to take your call and speak with you personally.
And I know you've helped a lot of people. Molly MacDonald, thanks for sharing some insight with us.
Thank you.
I'm Rhonda Schaffler for The Street.